welcome to this episode of Compliance Deconstructed. Lorie Davis and I are going to talk about HEDIS, not because it's glamorous. It is glamorous, but no, because we're very interested in the topic. There's a lot of complexity around what HEDIS is. HEDIS actually stands for Healthcare Effectiveness Data and Information Set. Elvan won't be joining us today, but that's okay. She's needed to take a personal day. So you're going to have to put up with me and Lorie. Thankfully, we're up for it and we're pretty excited about our topic. So HEDIS, what is it? It's a set of standardized performance measures used to evaluate how well health plans and healthcare organizations are delivering care and services. These measures are developed by the National Committee for Quality Assurance, or NCQA. Many of you may have heard of this organization in one way or another. And the HEDIS measures are used nationwide by health plans, by regulators, by employers, and believe it or not, even by, the general public to see how health plans are performing. So what does HEDIS actually measure? I won't cover all of it. I'm sure more will come out as Lorie and I talk about HEDIS and why it's so important. But HEDIS looks at whether patients receive evidence-based healthcare, recommended healthcare across all kinds of different domains. So it measures performance around things like preventative care. Think about immunizations or cancer screenings or well child visits. It looks at chronic disease management. Think of diabetes control or asthma care or blood pressure management, right? It'll look at things like behavioral health and depression screening and follow-up and substance use disorder treatment. HEDIS measures will also look at things like access to healthcare and how healthcare is used, or how health plans provide access to healthcare. So timely access to seeing your PCP or follow-up after hospitalization. And it'll also look at it. Actually, HEDIS is quite unique because it also, including all those other more objective measures, it looks at the subjective experience of a patient experience, right? And it looks at, survey information from actual patients. And that's often reported alongside the other HEDIS measures. So I've given you a little bit of a background about HEDIS to ground all of us in today's topic. So Lorie, can I ask you, why are HEDIS measures so important? What's going on here?
Yes, great question. And I am excited to talk about HEDIS because we're right in the thick of it right now. But the reason that HEDIS measures matter is that it is tied to both financial as well as accreditation outcomes for the health plans. And being successful, it's on providers, it's on members, patients to get them done. And there's like a giant, in my head, like a triangle, right? So up here's the health plan, over here's the provider, and over here is the member, and it's all tied together. There's truly 90, I think there's 90 plus different HEDIS measures available, and every state has some variation with NCQA of what's captured. So there's like 10 key measures, and then there's like a whole bunch of other measures that are looked at. But it's really important, like you said at the beginning, to look at quality, effectiveness, access to care that's provided to members. And that's what we care about ultimately.
Okay. So do these HEDIS measures, so NCQA develops these HEDIS measures, but do they affect all of healthcare or just certain aspects or certain health plans? Like, how does that work?
Yeah, in my experience, it's really Medicaid based that the HEDIS measures impact.
Okay. So we're talking about, even for Medicare, does it have anything to do with the Medicare star ratings or the Medicare Advantage star ratings?
Yes. Yes. It also ties into that as well. Yes.
Okay.
Good
So
call out.
wherever you that's okay. So wherever you have Medicare or Medicaid, you're probably going to have HEDIS. So
Yes.
if you work in that space or you work with a managed care organization, you're probably going to have heard of, NCQA and HEDIS and star ratings, things like that. And performance on HEDIS, correct me if I'm wrong. So part of the importance is we talk about it from a patient perspective and improving our healthcare and our access to healthcare, right? But it also has an effect on quality ratings. Am I right?
Yes.
And also on
Yes.
financial incentives and
Yes.
bonuses, and it affects auto assignment and enrollment
Hmm.
decisions and
Hmm.
contract renewals, and it could even result on sanctions. So could
Absolutely.
you tell us a little bit about how that works? Like, how does HEDIS influence, for example, quality? Like, what's going on here?
So, one of the things to keep in mind with HEDIS is it looks at things that come in on a claims form. So when you go to as a patient or a member, when you go to the provider, they fill out a claim form that gets submitted, and there's certain things they're looking for that are there. But there are some other elements that they need to go after into what's called chart chase that collects data that's not typically captured on a claims form. So you'll hear if you're in healthcare and someone you know is involved in HEDIS, you may hear them say, "Oh, it's chart chase time." And when you think about it, you have to remember that just means they're going out to get elements that are in provider records that may not have been submitted with a claim. So having that together really helps reinforce and enhance the reporting that HEDIS is work is focused on.
So that's really important, I think, that people understand that process, because here's the health plan trying to collect data to enhance the patient experience, to make
Mhm.
sure that patients are getting the care that they need. And only so much can come through claims, right? So,
Yes.
from a provider perspective, I mean, providers sometimes really struggle and there's a lot of pushback.
Yes.
So, can you explain? I mean, why is that? What's going on there? So, the health plan has a duty, not just a duty, but it's trying to do the right thing,
Mhm.
right?
Mhm.
But what's going on with the providers on the other side?
So it's probably a combination of things, right? So multiple health plans are showing up to my imaginary doctor, Dr. Fulanito, and saying, "Hey, Dr. Fulanito, we need case files for XYZ patient." They really probably have some staffing and bandwidth issues. And I will say the introduction of EHRs or electronic health records have probably helped, or EMRs, they might be called electronic medical record. That's probably helping a little bit. But if they've got the traditional paper records, can you imagine you're trying to see patients, you're trying to schedule patients, you're trying to do all the follow-up that comes with all those patients. You're the provider trying to do your duty and all your paperwork, and then all these health plans descend on you and say, "Send me all the case files." So there's some bandwidth, some capacity going on. A lot of times the health providers will enlist the aid of third-party vendors or subcontractors to help them get this data, just because on the health plan side, they may not have that specialty or that capability. It may not be a focus of theirs in a lot of cases, so getting that third party that can be lean and mean with it really can help drive efficiency. So I think there's that push and pull going on.
And I asked that because you and I have been through this many times with
Yes,
HEDIS, and it's
yes,
such a stressful time, really, for everybody. And
it
there
is.
is that tension, and we're trying to be cognizant of our providers and try and help to the best of our ability. But there's always this tension, and it's
Mhm.
really stressful for everybody.
It
So
is.
You said when we started out that this was a great time to have this podcast. So, what's going on at the moment? Like, where in the HEDIS cycle? First of all, how does the HEDIS cycle work? Where are we at the
Yeah.
moment?
Yeah. So right now we are in the middle of data collection, aka peak chart chase. So they're doing claims analysis to see, okay, what do we have? What do we need? And they're starting to reach out to those providers and getting things in. They're doing the abstraction from the charts that they get. They're really working to get this all done. And that typically will go through a lot of health plans try to be done in the first quarter of the year, so January, February, March, and they typically have until May of the year to get it done. Now, keep in mind that we're in 2026 when we're recording this episode, and so the measurement year that we're talking about can be from the prior year, right? So we're doing a look back to 2025, but we have to get all of our chart chase for 2025 in by the end of May or by May 15th of 2026. Hopefully I didn't make that too confusing. And
You
then the
haven't.
final submission to NCQA typically happens in June, and that's where you submit all of your final audited information. And then starting in July, August, NCQA starts reporting out, including star ratings, Medicaid quality, accreditation updates, and public reporting. So typically everything NCQA collects is made public. So to your point, consumers, anybody can look at it and see where everybody kind of fell out.
So, let's roll that process back a little bit. So, I heard you say the word abstraction. But to be honest, until I worked in the health plan space, I wouldn't have known what HEDIS was. I know what quality measures are, but I wouldn't have necessarily known exactly what HEDIS was. And I certainly wouldn't have known what an abstraction is. So can we start from really the beginning of the process? Like what's going on here? What is abstraction? What is abstracting and who is abstracting?
Yeah, great question. So at the end of the day, remember the provider will have typically already submitted a claim. And so they're going to look, okay, here's all the data that we got from the claim. Here's what we need as part of HEDIS. So there's a gap, right? And so they're going when they get the chart in, they're going to abstract from the chart that delta between what they have and what they need.
Okay, so they're
That
gonna
that's the it's a simplified. I'm trying to make it very simple for people, but that's essentially what they're
yeah.
doing.
Yeah, yeah. No, I think you've described it perfectly. So the health plan is looking at the claims data. It's saying, okay, well, here's the data that we have, but here are the HEDIS measures, and there's like a we're missing some information. So how do we go back and get it? And that process is called abstraction, right? You're
Mhm,
taking out, you're
mhm,
removing. Okay, so
correct.
that's wonderful. Now,
Yep.
when the health plan is going back to the providers, are they looking at every patient that the provider actually treated or had an encounter with? Like, or are they saying, hey, we're only going to look at a subset? Like, how does that work?
Yes and no. So they're looking at an individual health plan is looking at the subset of all the patients, but they're really looking at those patients that had encounters with the provider that are applicable to the HEDIS measures they're capturing. So, for example, if we're talking about let me look at my list of measures. Let me pick a fun one. Um,
Fun
ah,
one. Fun one.
yeah. We'll do immunizations.
Yeah.
So childhood immunizations. So they're going to go to the pediatrician or the PCP. They're going to look at the members that fall into that age category for those immunizations, and then they're going to look and say, okay, so if a child went to see the pediatrician, let's say it falls in an off year where they don't have to have any immunizations, then they're not going to look at that patient and they're going to keep rolling. So it's not wholesale every patient that the provider sees that's under that health plan. It's really those ones that are impacted or in scope, if you will. That's a
Is
good
it
question.
correct? Is it? Yeah, I've actually always wondered that one, and I should know it, but I forgot. There's a lot of information that goes around in our heads, guys. For
Yes.
listeners, we have a lot of information, Lorie and I, going through our heads at any one time. Sometimes we're going to forget things. I'm sorry. All right. But when we talk about, I just want to nail down for those who are listening, because it's not like you find information about HEDIS everywhere you go, right? You really don't. You
No.
kind of land
No.
yourself into it and then you
Yeah.
find out about HEDIS. So we talk a lot about closing care gaps.
Mhm.
So
Mhm.
how does that, first of all, what does that phrase mean and how does it fit in with HEDIS? So when people hear
Yeah.
these things, they hear, okay, I know that HEDIS is a measure. I know it's developed by NCQA. Okay, fine. We now have chart chases. But actually, now I hear this term called a care gap. Like,
Yeah.
what's happening here? What does it mean?
Yeah, that's a good one. I'm gonna tell you what it means to me, and you may have a different or expanded definition, and I'd love to hear that too. In my mind, it is thinking about a particular measure. I'm just gonna pick on one measure. We'll stick with immunization.
Okay.
So let's say that there are 5,000 children that are eligible for immunizations. It's really making sure how close you can get to that 5,000 and getting those immunizations. And there's a strategy in terms of educating the members, and again, it's kids getting immunization, so you really wanna go to their parents, their guardians, their caregivers, and saying, "Hey, this is why your child should have it." It's educating the provider on why they need to talk about the importance of immunizations with the patients and the families and have that informed decision about getting them. And then it's looking at last year of our 5,000, only 2,000 got immunized. So, we need to come up with a strategy to improve that number so that, anything above 2,000 would be a great improvement or closing that care gap. But you really need to break it down individually for each member slash patient. And I say member because the health plan looks at them as a member, whereas the provider looks at them as a patient. So I
Yeah.
keep using those two interchangeably, and I don't want to confuse the listener. It's truly the same person, but it's just who's talking to them. So for me, care gaps, when you look at that, it's something that maybe, when I think of breast cancer screenings, that's always something that, you hear a lot of talk about, particularly in October, which is Breast Cancer Awareness Month. But you wanna be talking about it all the time because folks that are getting screened could do that, not just in October. They don't only happen in October, but you typically see a lot of mobile vans or people setting up additional screenings during that month. But that could be a gap where the amount of available or eligible folks to get that treatment don't get that treatment, and you wanna improve it or close that gap. That's how I look at it. So, I'll turn it over to you for your additional insights.
No, I mean, it's pretty much the same. It's a healthcare, some aspect of healthcare that a patient should have received that's considered high quality or the
Mhm,
a basic standard of healthcare that they
mhm,
didn't receive. If we go to the breast cancer screening, having women having these screens is considered to be just basic healthcare.
mhm,
It's a preventative measure. So the care gap is when, a woman doesn't have that screen when she should have. And you can
Mm.
see from the health plan's perspective, they want people to be healthier. They want people to get these screens and the preventative screening and the care that they're supposed to have. I mean, that's
Mhm.
part of what these HEDIS measures dictate, right? They're
Yes.
dictating a certain level of healthcare quality. And it's the health plan's responsibility to make sure that patients are getting that level of quality service. So the gap arises then when the patient doesn't get that health care. And of course, in order to meet the performance measures or to meet HEDIS measures, that health plan has to do what it needs to do to make sure people are getting this health care. So some of
Yes.
that, I'm really interested in this. And I know what you mean because I've been there before. But this idea that healthcare providers don't always know or aren't always having those conversations. Now, obviously, there's not a strict science to this, but can you talk a little bit more? Do you see a lot of that where healthcare providers actually don't know what the standards are? And how does a health plan tackle that?
Yeah, I think in my experience, it's the providers are educated on what immunizations are or, the need for breast cancer screening at the highest level, but they don't necessarily always put it in the framework of, "Oh, this is a Medicaid member. Oh, this is a Medicare member. Oh, this is a CHIP member. I need to specifically make sure that I'm focusing on these items because it impacts HEDIS." I don't think it's like that. I think it's more, "Oh, the child is less than 1, they need to have these vaccines. Oh, the child is 3, they need to have these." They know the general schedule of vaccines, and they're trying to talk to them about that. So I do think that as health plans, we need to do a better job of making sure that the providers have the tools that they need to have that conversation that is targeting the right populations with the right language to and especially in the current environment when there's pushback or questions or concerns, being able to answer those effectively and positively to help families make the best choice for themselves.
Okay. And it's a hugely complex area. I mean, we're talking
Yeah.
about it. And, as we just talk about it, maybe it doesn't seem so complex, but the systems and the number of people and the resources that go into understanding the HEDIS measures, but also being able to identify care gaps and then
Mhm.
being able to take action. I mean, I've been there before. There's not just the work with providers, but there's work in supporting providers and getting vendors, like hiring companies
Mhm.
or third parties to help provide services, like maybe hiring out a mobile service. I mean, sometimes the health plan actually has to hire third parties themselves to
Mhm.
close these care gaps. It's really important. So there's so much going on. And on top of that, there's the chart chasing and then looking at the charts and being able to pull that data from the charts. And then there's the preparation. Well, how do you validate the data? And
Mhm.
are you able to talk a little bit about data validation? So, all this stuff is coming in. There's all of this work. It's super, super stressful. It requires so many parts of the organization to be working together. It's just not
Mhm.
for the faint-hearted. And
No.
it's so public.
Mhm.
The consequences or the results are so public. There's no way to hide from it, right? So, what's the data validation piece? What's that about?
Yeah, so typically in a HEDIS measure, we talk about care gaps earlier. You come up with what they call a numerator and a denominator. Basically, the total number of people that could have this done and the total number that actually had them. And so when you have just the claim data, you start with a number on both sides, and then when you do the abstraction where you've got that additional data from the provider, those numbers could change a little more. And then you need to verify and validate that what you pulled out on both sides, both from the claims as well as from the charts, and I apologize for my hand gestures, but I find it helps me explain it, making sure that everything matches. So, again, I'm using nice, round, easy numbers this morning. So let's pretend that our total possible was 10,000 total possible, and we ended up with, I don't know, 6,000 because that number sounds happy. Uh, and once we do everything, does that actually make sense? Or, do we need to adjust it one way or the other because we missed something or there's additional data coming in? And this is constantly getting refreshed during chart chase, because as you get additional data and you validate the data, those numbers could change. So you want to make sure that your data is as accurate and as clean as possible before you move forward with the rest of the process.
So it could be something like 10,000 kids should have technically received a certain vaccine, but
Mhm.
actually, according to our records, only 6,000 actually got that vaccine, which
Yeah,
means you've got 4,000 kids who should have gotten the vaccine and for whatever reason didn't.
exactly.
Okay.
Exactly. Yeah,
And there's a whole process behind that to make sure that that data is correct.
exactly. It is so important in the process.
But why? Why is it so important that the data be correct here? What's going on?
So it's important at the baseline because when we're reporting out to NCQA, again, remember we said at the beginning that this is your accreditation, this is your financial compensation, this is your star rating. So when people are looking at a plan, do you want to sign up for the plan where only 6 out of 10 kids got vaccinated versus another plan that may have got 8 or 9 kids? So again, I'm boiling things down to pretty simple numbers, Jess. Our health plan's really small with 10 kids, but we're really good with eight vaccinated. Um, go small health plan. So that kind of thing. So that's why the data matters in the simplest terms I can make it.
Okay. No, I mean, you've done a really good job. I mean, I get it. Where if your data's not clean, I mean, not just with HEDIS, but in life and in the business world. But
Mhm.
I just wondered why specifically for HEDIS? What are we trying to achieve? Right.
Yeah.
And so the next question then for me, if I go into where you and I actually specialize, and that's the compliance piece. So what's the role of compliance here, first of all?
So so compliance has a huge role to play here for a lot of different reasons. I think the first one is that vendor oversight and helping make sure that if you're outsourcing to a third party, that there's oversight of what they're doing, that the appropriate safeguards are in place, because this is sensitive member data. So you want to make sure that it's safeguarded and protected. You wanna make sure that you've got regulatory accountability. Make sure that you've got the latest and greatest NCQA protocols that you're
Yeah.
following. Are you following the right measures? NCQA has modified, updated, revised, changed measures year over year, so you wanna make sure that you've got that. You wanna make sure that you're at the table if there's any sensitive data being shared and transferred, that things are again, that protection, that HIPAA and PHI and super PHI protection safeguards are in place. You want to make sure that from an audit perspective, there's an audit that goes with this. So you want to make sure that you're supporting that, and accreditation reviews are supported, as well as contract compliance. You want to make sure that if any gaps in care or population health risks arise, that your team is supporting that. And again, just protecting the organization against any reputational and risks with our friends in legal, of course. But really, it's just making sure that you're at the table with the typically it's the quality team that
Yeah.
runs HEDIS with the support of compliance. I know it can vary from organization to organization, but really having compliance at the table just make sure that there's appropriate guardrails in place to keep everyone involved, protected, and the data secure.
And it's so important. I mean, it's easy to underestimate, I think, the role of compliance, but having lived it, the truth is, it's a hugely stressful and critical part of the organization.
Mhm,
This whole all of this process around HEDIS, right? And there's an incredible amount of pressure, and that can incentivize people to take shortcuts. And
mhm,
actually, things happen that you really wouldn't believe. You know, mistakes happen, or people
yeah,
intentionally take shortcuts because the pressure is immense. And, so first of all, compliance has this role. They've got to keep up with any changes. They've got to make sure that everyone understands what's expected of them. And it's not like from year to year, the staffing is the same. You can always build on knowledge. You've got to be really aware that you may have leadership changes and staffing changes. So there's an ongoing educational process. There's a process around auditing and keeping those conversations up with the quality team so that you're, through the year, you're keeping an eye on these HEDIS measures and closing care gaps. So there's no big surprise come the end of the year, right? There's no big shock, and that you can kind of initiate those conversations to say, okay, well, if you haven't thought to take corrective action, well, quality, what corrective action? Like, how do we, steer this in a different way? But really acting as an advisor in that capacity,
mhm,
and being able to, report on these regulatory requirements to senior leadership, acting as that kind of check and that balance. Is quality really, are they on track? Are they trying to do? And with Medicaid and Medicare, there are also, how you correspond with providers, how you send out that CAP survey, and what the language in that CAP survey is. Like, there's so much going on here. The language that you have to use, and what must be approved, and how things are sent. And we talked about, sometimes the health plan will hire vendors to help close those care gaps. Well, as you said, Lorie, there's so much compliance risk there as well.
yes,
So, there's, is there a contract in place? Is the contract signed by all the parties? Is there a business associate agreement in place? Is the information being sent out appropriately and being sent back to the health plan appropriately? Like, all of those different relationships. And in fact, some of my biggest, I hate to say this, but some of my biggest privacy issues as a privacy officer came around the chart chases. It was
yeah,
absolutely incredible. And also sending hard copies of information and making sure, they go to the right person at the right place, and that the paper records are labeled, they go to the right person. I mean, small things like not saying, hey, these records go to XYZ health plan or XYZ hospital, but actually having a name. It goes to a specific person, double checking the address. Honestly, some of my biggest privacy breaches and HIPAA violations came from what seems like a small thing, but really isn't. So, and in the
yeah,
context of this really high pressure activity, these things really do happen. And so, compliance being at the table, they're another resource, they're another pair of hands. They're also trying to keep all of the processes on track. And not just because it's a regulatory requirement, but to clean it up when mistakes do happen or things go wrong. The cleanup adds an extra dimension of pressure and stress to
yes,
everybody.
yeah,
That's
uh,
why it's so key.
yeah, and I have to say, I think the quality teams that are working on HEDIS, that if you have not been part of a HEDIS audit or the HEDIS roadmap year, I really encourage you as a compliance person to make sure you reach out to your friends in quality and talk to them about it. They are doing amazing work
Yep.
and they are really trying their best to make your organization shine, to make sure that every member of your health plan is getting what they need and they're coming up with innovative programs. A lot of times there's, especially during back to school season, there's that big push to make sure that kids are getting their vaccines and dental screenings because guess what? Schools require it in many states, or, you can file exemptions, but it's required. And so parents, how many times have you been a parent where you forgot the form or, oh, you did it, and then you have to go back and the doctor charges $25 and all of that. So they're really trying to make sure that it's not a barrier to their success. But more importantly, we've talked about this as very data, 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 but at the end of the day, it's really wanting to make sure that every member is as healthy as they possibly can be and giving them every opportunity to get those oh so important screenings and vaccines and tests that just keep you healthy. And instead, that ounce of prevention, pound of cure kind of equation going on. But really, to me, that's what HEDIS is doing. And I really wanted to say, as a compliance person, thank you to all my quality friends that are going through HEDIS right now. I see you, I support you, and oh my goodness, you're doing so much work.
Yeah, you are. And I mean, I'm glad that you called that out. So just to give some perspective, our quality folks are having to work. Let's think about this: compliance, risk adjustment, care
Mhm.
management, enrollment. I mean, vendor management,
Encounters, claims,
procurement. Yeah, claims,
finance,
encounters. They are, I mean, they're in
provider
the thick of
network.
it. Yes,
Yeah,
absolutely.
yeah.
They're having, so on top of doing all of this other stuff that we were just working through, they're having to partner in order to make it all work. They're having to partner with just about every other team in the organization. That is incredible. The only other team that, comes to mind immediately is compliance.
Mhm.
But quality is that part of the, almost like the engine of they're working with analytics as well. We don't want to leave our analytics out, but they're working so closely with so many teams in order to make all of this happen. So it's not just about the chart chasing or the abstraction
Mhm.
or the
Mhm.
bits and pieces that we were talking about. It's so much more. It's a dynamic rule, super stressful, not for the faint-hearted. We say that a
Yeah.
lot, but a
Yes,
lot of these
yes.
jobs are not for the faint-hearted. They take a lot of expertise, quick thinking, problem solving, and being able to work under extreme pressure.
Yes. The one thing just that I wanna make sure I point out is we've talked a lot about compliance and why it matters, but if HEDIS doesn't go well, there are consequences that I wanna make sure we put out there. The
I was going
first
to
of which
ask you about that next. So
Oh, okay.
we're thinking
Yeah.
alike. We're great
Excellent,
minds.
excellent. So the first one is lower Medicare star ratings. And star ratings, a lot of times when people are looking for their plans during open enrollment, they will look at the rating of your plan. And so if HEDIS doesn't go well, you have a lower star rating, you may have fewer folks opt into your plan. The loss of quality incentive payments, and for both a Medicaid and Medicare plan, dollars matter. So fewer dollars coming in means fewer programs you can run, less you can do for the members themselves. In some states, it impacts your auto assignment or enrollment, leading up to even including potentially suspension of enrollment, not being able to take on new members, which again goes back to dollars.
So that means the
Obviously,
state doesn't want to work with you as much, right? They're not
correct,
encouraging people to enroll with your health plan
correct.
because the quality of your care seems to be less than maybe others.
Yeah, so in Medicaid, sometimes they will do what they call auto assignment, where they will rotate through the health plans and assign new members to the health plans, or a member will sign up for a health plan and then it gets assigned to them by the state. So that could be reduced or stopped completely. Obviously, you'll be open to increased regulatory scrutiny and potentially be given corrective action plan. So you got to fix problems. Obviously, your accreditation with NCQA could be at risk. You may lose your accreditation, which for Medicaid plans, that is often, not always, but often a requirement of having a Medicaid plan in a state. So that could be a big deal. And obviously the general reputational damage with members, providers, and regulators as a result of you not meeting measures. Now, this sounds very drastic, so I want to be transparent that in many states, I can't say all because I haven't worked Medicaid in every state, but in the states I've worked with, there is regular reporting and interaction with the regulators where you're saying, "Hey, this is where I am." And they are asking questions and they're asking you, "Hey, what's working? What's not?" And I've had the very positive experience that regulators are trying to share best practices. So if you're struggling with a measure, they may say, "Hey, we talked to another plan and they're doing this awesome thing that really worked." Or maybe you're the one doing awesome things and they want to hear more so that they can share your awesome work with other plans to help them. So I did want to kind of talk through that. It doesn't automatically mean you're bad, you're going to have all these other problems, but the regulators want to hear. And I will say NCQA, sometimes when they're adjusting the measures, it's as a result of health plans struggling or having issues, and they're trying to make sure that it's obtainable for members and health plans and providers. Again, they're thinking about that triangle and all sides. So I just did want to make sure I included that.
No, that's a really important topic, and it's something that all the health plans kind of worry about. There's like kind of
Yeah.
watching, there's a very trying to figure out where your scores measure up against other health plans. And it's a real thing. And being, really worried and anxious that maybe you're not performing as well as other health plans. And what does that look like? And what does that mean for your business?
Yeah.
Or for your health plan. So I'm glad we could talk a bit about that and what the consequences are. It can be a really anxiety provoking time, and the corrective action. Then on top of everything else, you've got to steer the corrective action while you're doing all these other activities. So like so many things in compliance, right? Better
Mhm.
to try and have an organized plan, monitor as you go to make sure you stay on track, and try and take corrective action early. So that brings me to this question. When we were prepping and talking about this, when is the best time to start planning for HEDIS?
Yesterday. No, um, I I
She means it. She's laughing, but she meant it.
um, so I will say that I believe at the end of the HEDIS year, it's a great time to kinda do that lessons learned. So July-ish, when you're getting your ratings, you can start planning for the next year, but anytime I think between May 15th when you press that submission button and July 15th when you get your feedback or that final reporting, I know sometimes you don't get things till August, but really having those ongoing and recurring discussions and you're course correcting throughout, but having a plan, you know, May and starting to talk about what are we gonna change. I think it's, and keep me honest, Jessica, I wanna say it's November, December, you need to send some incentives in. Typically, if you're gonna offer any incentives for your measures, sometimes, it could be November, December. So you wanna think and budget for if you're gonna offer any incentives for whatever measures you most want to drive. A1C is another one that comes to mind. There's always something around there. There's some other ones, but again, I know they vary from state to state, so I don't wanna get too hung up. But I think the earlier you start planning and you're course correcting throughout. So maybe, even with the best of intentions, you start out really poorly in a measure. You want to be looking at your data and saying, oh, let's go course correct. Let's go change what we're doing. Maybe we need to add an incentive. We didn't plan initially to add one, but we want to drive that measure. So something like that.
So there's a lot to unpack there. And the key to it is planning.
Mhm,
And I
mhm,
love what you said about, finishing the HEDIS year, but then taking the time to identify, what did we learn from this? What did anything go unexpectedly and why did it go and what can we do differently? And
mhm.
I love that idea. I think it's the right thing to do. And I'd say that, in addition to that, yeah, you're planning for the whole year. You're trying to think of a strategy. So you talked about incentives, and that's the time to think about, might we have to offer incentives? What does that look like? Who would we use? Getting that, okay, well, can we research some vendors or how are we going to manage this? I've seen some of those conversations happen last minute,
Mhm,
and it's an
mhm.
impossible situation that is so stressful when actually, if you're planning this, right, I know I want to hesitate to say right, but if you're really planning this, something that you can do is think about those issues really early on and how you might be handling them, so that in the event that certain things come up or you need to take advantage of certain activities or leverage certain activities, you can do it quickly, smoothly. The process and the thought has already gone into how it would work, right?
Yeah, and any partnerships, maybe you're gonna partner with certain communities because you can embed yourself. They're having community events, they're having those back to school events, they're having something in October, they're having something in the summer, whatever. Look in your communities where you can be to be there to be talking about the measures with people in the community. There's so many community organizations that are trying to make sure that their communities are healthy, the people in their communities are healthy, and so partnering with them gets you a little more buy-in. If I
Yes.
show up, they're like, "Who are you? I don't wanna talk about vaccines with you." But, "Hey, there's Mary, and she runs this community outreach thing," and they're like, "Oh, Mary? Mary's talking about this? Yeah, yeah, we like Mary, we trust Mary."
Mhm.
And that's normal, and that should be how it works. Health plans should really work in partnership with those community organizations that are there every day for their members, because as a health plan, we can't be everywhere to really help in person. We can put boots on the ground, but if we're not embedded in that community, we may not get as much buy-in. And again, that's where compliance needs to be at the table to work with the marketing folks to make sure that the messaging that's going out is appropriate and accurate, and if state approval is required, making sure that those state approvals happen.
And I love that. That was something we didn't talk about earlier, but just to add another layer to this, that community liaison and that partnership is critical to
Yeah.
closing care gaps. I don't think any of us could do what we do without the support of our community groups. That's just a fact. Um,
Yes.
you talked about incentives. So
Mhm.
that could be not that it's tricky, but it could be misunderstood. So when we talk about incentives here, what are we actually talking about when we incentivize or encourage our patients or our members to get particular treatment? What are we actually doing?
Yeah, so that's a good call out, and again, I wanna say from my friends in Medicaid, if you are talking about an incentive, please make sure that you consult your agreements and you talk to your
That's
regulator. Do not go and say, "Oh, we're gonna give everybody X dollars and, we're gonna throw them a pizza party." You have to look at what your agreement allows. There are very strict protocols. You can't just give them an Amazon gift card and call it a day. There are very strict protocols around it, again, in Medicaid. So please, please, please go seek a professional's help. But what we're trying to say is there are certain measures that we're really trying to drive. So we may want to incentivize or motivate people to do that. And so, again, it could be a tchotchke where we're giving away a keychain or a stress ball or something little. It could be a $5 gift card or something like that. But again, we're doing it with regulator insight, awareness, and approval. We're not, and that's why you need compliance at the table. It's because I don't know about you, but I can remember a time where I worked with somebody who's like, "We're gonna give everybody $75,
Yeah.
carte blanche, $75 if
Yeah.
they get a flu shot." And we were like, "What?" Um, and
Yeah.
then we pulled out the agreement, and the agreement had a very different dollar amount that was considerably less, and they were just like, "Oh, oh." So again, everybody's got fantastic. I think their heart was in the right place. They really wanted to change this measure. They really wanted to make sure that the members were getting the care that they needed and deserved. But unfortunately, the agreement just said, no, you can't do that. So I think that's a good call out, Jess.
Yeah, I just wanted to make sure that people didn't get the wrong idea. It's like a little
Yes.
gift or a little incentive, a
Hmm.
motivation for
Hmm.
people to go get healthcare.
Yes.
That
Yes.
that's at the bottom line of it, just a little extra something to
Hmm.
encourage people to go get their flu shot if that's what we're talking about, or go get their diabetes checked or whatever it is,
Hmm.
or blood
Hmm.
pressure. That's
Hmm.
all. And I'm glad that you said check the contracts because that's I just wanted people to be, yes, it's allowed. You can motivate people to get the health care that they may need, but there are a lot of rules around this.
Yeah,
Um,
and for Medicare, you need to check the rules as well because they have different protocols than typically Medicaid. And if it's CHIP, you need to check their protocols as well.
So we could actually go on.
Mhm.
There's so much more to HEDIS. I love the topic, although, sometimes it takes my breath away because it's the
Yes,
complexity of it,
it is.
right? And there's
Yeah.
so many, I mean, it's a really, it's an area where you have to have quite a bit of expert knowledge. It is not an easy field to get into. So
No.
you build up that skill set and that knowledge base. There's no school that teaches you about a HEDIS. It is literally experience. You have to get in there and you have to talk to other people and network and really learn. And it's almost like trial by fire,
Mhm.
I found. And very lucky that I got to work with experienced people. I know you were the same, Lori.
Yes.
We've been very lucky. We had the opportunity, but also we have had some very good coaches and mentors, but
Yes.
not everyone has that. And even then, there were a lot of gaps in our knowledge that we had to learn for ourselves and mistakes. You dust yourself off, and
Yep.
and that's part of the process. But that's one of the reasons Lori and I thought it was so important to do this podcast in the spirit of helping to explain and educate and put that awareness, and also to say, if you find this topic confusing or stressful, you're not alone. There's nothing wrong with you. That is absolutely normal. So network, ask questions. I mean, you can even get in touch with me and Lori and say, I have a question, but definitely
Absolutely.
network, do your homework. It is very difficult. It's a difficult space, and there's nothing wrong with acknowledging that. And on that note, I'm going to say, I think we're going to wrap up.
Excellent.
Um, we could easily do a whole nother episode on HEDIS. So we're going to leave you with that because it's probably your brains are probably full and you're like, stop, stop. This is my second podcast in a row where my brain is going, Jessica, really? You got to quit. This is enough. We've got the rest of the day to get through. You got work to do. All right. I'm teasing. I'm joking. But Lorie, thank you so much for sharing your expertise. You're right in the thick of it at the moment, and you're very much exposed to all these different conversations on top of all the other work that you're doing. And so I really appreciate your taking the time, specifically today, to talk about HEDIS and what's going on in that space. So
Well,
hopefully our listeners have learned something.
yes. And thank you because you have a lot of HEDIS knowledge, and I appreciate us being able to have a great educated conversation. The one last thing that I want to impart on my compliance friends is if you have questions, go out to the NCQA website. There are some fantastic resources out there. I will say that NCQA is active on LinkedIn where they're always offering webinars where you can go learn more. Don't be afraid to ask your friends in quality for insights. Maybe not right now, maybe in February or March, but ask them questions if you want to understand better. Or again, Jessica and I are happy to be great resources for you as compliance folks, but talk to the folks in your organization too. They've got fantastic experience and insight that they, I'm sure, want to share with you.
Absolutely. Eye opener. Best advice.
Mhm.
Go out there and talk to your colleagues. All righty, folks. Lorie, thank you. I'll see
Thank
you
you.
next time.
Take
Listeners,
care.
thank you so much for putting up with us, and we'll see you next time.
Take care.